Hi there, my name is Magdalena. I am a KPU student, and today I'm going to be demonstrating how to set up a sterile tray for dressings for wound care. So I'm going to start off just by washing my hands. I'm going to introduce myself to my patient, make sure that my patient doesn't need to go to the washroom or anything, and explain to my patient what I'll be doing today. Then I'm going to apply my clean gloves. So I'm just going to take the clean gloves, put them on one at a time. Okay. Now I'm going to make sure that the table is at my waist level, which it is, at which point I can start to open my package. So I have my dressing tray here. I'm going to make sure, just read the contents, make sure that I have everything that I need in there, and I'm going to remove the plastic and the label there. I'm going to start off by lifting the flap that is closest to me and removing it away from my body. Then I'm going to take the one of the side flaps and open it up to the side. And same with the other side. Just making sure just to touch within the 1-inch outer border that is not sterile, to not contaminate the tray. Now I'm going to pick up the tab that remains and just pull it towards myself. Now I see there's a pair of forceps here, so I'm just going to take these to help me open up the tray. And I'm just going to readjust it here to make sure that it is square to the table, make sure that I have enough space here. Okay, so I see my larger pad at the top, so I'm going to lift that up with my forceps and just turn and place that onto my patient, making sure that I'm not turning my back to the sterile field, and also making sure that I do not lower anything below my waist. Now I'm going to lift the garbage bag with the forceps and once again drop it onto my patient. Now I'm going to pick up the pads, so I have a few smaller pads, just placing them within that 1-inch border onto my sterile field. My larger pad. Just placing it off to the side. I have a couple of forceps here, so I'm just going to move them off to the side as well. Okay, and now I'm going to place my forceps down with the part that I've been lifting everything with, the sterile part facing in, and the part that's already contaminated by my fingers facing outside of the 1-inch margin. I'm going to take my saline solution now. So I'm just going to check the label before I use it, make sure that it's not expired, make sure that it's the correct solution that I'm needing, and open up the lid. Place the lid facing up, and making sure that the label is facing towards my hand, and so that I'm pouring away from me. I'm also making sure that I'm coming down pretty low here to minimize any splashing as I begin to pour it into my tray. So placing it off to the side, recapping the bottle, and placing it off to the side. Now I'm just going to demonstrate how I would open up one of the gauzes. So I'm just taking one off the side, grabbing onto the side flaps and beginning to pull it out, making sure not to touch the inside sterile area, and making sure also not to touch the gauze itself. So ripping it open, and again just dropping the gauze onto my sterile field. Placing any garbage off to the side, and then at the end I would, once I'm done, I would remove my gloves and again wash my hands. Thank you.